Okay, so there's only a few of us, but it doesn't matter because whoever is here is going to benefit from what I have to talk about. So I wanted to do a webinar, and I wanted to talk about. So the topic is going to be short because I really want this to be interactive, and I want you to ask your questions. It's about three biggest obstacles to optimizing your health. So I just want to talk a bit about how I got on this journey. So I've been a physician for about 18 years now in practice, not including the time I trained. And I've always actually been interested in human potential and human behavior from a very young age because of a lot of adverse experiences I had when I was younger. A lot of challenges, which it's not the topic of this webinar, so I don't want to get into it, but I just got really interested in human behavior and potential. And I entered the medical profession out of an interest in human physiology, the ability to impact lots of people's lives as a physician, and the ability to potentially work in anywhere in the world. So, I entered medical school. I got into my specialty, which is pulmonary critical care, and I had up until then, before I got into medical school, I had been reading a lot about consciousness and metaphysics and healing and human potential. Then I kind of got really busy with training and in the beginning of my practice, and then I got off track. But then when I started practicing medicine, I started to realize that just people weren't getting better, especially those with chronic disease. We were just perpetuating the whole paradigm of chronic disease. And then I went on this journey to try to understand why people were not getting well, why they weren't healing, what were the barriers to optimizing health. And that's what led to give me 1 minute. I'm just going to grab something. So that's what led me to write my book, Healing from the Inside Out. Okay, so I wrote a book, started it, it got published 5 years ago. I started it many years before that. I would say about maybe 5 or 6 years before that. And it's really my understanding of what it takes to heal and optimize your health. And it's not just about treating chronic disease. It's actually about true healing. So I'm going to get right into the topic, and then I'm going to give you guys a chance to ask me any questions you have about your health or health questions in general. So the three biggest obstacles to optimizing your health, as far as I understand them. The first obstacle is that not you, but people in general, only rely on the current conventional healthcare system, the allopathic healthcare system. So that may seem strange coming from a physician who operates within that system. But you see, the thing is that I have the advantage of being in the system and seeing the effects of it. And the thing is that the problem with allopathic and conventional medicine is that it only has a one-dimensional understanding of the human being and what goes into creating disease and what is needed to optimize health. So when we go through medical school, we're taught physiology, we're taught anatomy, we're taught biochemistry, we're taught pathology, and we're taught about diagnosing disease. But we're only taught the level of the physical. So the thing is, the problem with allopathic medicine, conventional medicine, is that it doesn't encompass the totality of who we are. And this is why, for your optimizing your health and your healing, you cannot just rely on your family physician and the healthcare system as it operates in its current form. Now, don't get me wrong, the medical system performs amazing things, miracles even. Like if I were to say fracture my hip, I'd want to go to the emergency department. I'd want to see an orthopedic surgeon. I'd want to, get the surgery that I need. If I had a bad infection like a pneumonia and I was very critically ill, I would want to go to the emergency department and get that treated. But what I'm talking about is for chronic disease. So chronic diseases are many: hypertension, diabetes, heart disease, heart failure, asthma, all sorts of cancers, autoimmune conditions, endocrine diseases, chronic kidney disease, all sorts of those conditions. Often you need medications to treat those things, but that's not where it ends. You see, the thing is that you go to a doctor will take a history from you. They'll do a physical exam. They may run some tests, and they'll take all that information and come up with a diagnosis, give you a diagnosis, and they'll prescribe a bunch of treatments. Some of those treatments may be pharmaceutical. They may involve procedures. They may involve surgery. But that's where it ends. But the thing is, that's just the beginning. That's not where it ends. That's just where it starts. Yes, sometimes medications are needed. Say you come in to the emergency department with a dangerously high blood pressure. If you have a very dangerously high blood pressure, we call it hypertensive urgency, and it can become an emergency. It can lead to a heart attack. It can lead to stroke. It can lead to kidney failure. It can lead to other things. So yes, you do need pharmaceuticals at some point, but it doesn't end there. And unfortunately, in conventional medicine, it ends there. Okay. So this is the first obstacle to optimizing your health, is that majority of people just look towards their physicians and their specialists. Okay. The second obstacle to optimizing your health is that everybody is looking for a single solution to their health issue. And this is how the medical system operates. So we're lack of a better term, we're a one-pill society. So what do I mean by that? Everybody is looking for that single pill or medication that's going to fix their problem, right? Whether it's hypertension, whether it's diabetes, even things like anxiety and depression, everybody just looking for that quick fix. And it's just because we live in this fast-paced, highly technological consumer society where everything is available at the click of the mouse, right? I mean, you can order things from Amazon, you can order food to your door that'll arrive within 15, 20 minutes, right? So we live in this society where a lot of things are right at our fingertips. Unfortunately, optimal health does not work that way. Okay, it's not a quick fix. It's not a one-pill solution. It takes work. It takes research. It takes diving in to learning about the things that your physician, your specialists are not going to teach you. So you have to do the work. You have to do the research. You have to do that deep dive. And that's what I did to write my book, Healing from the Inside Out, because I had a passion for learning about how to help people heal and optimize their health. So the second obstacle is looking for that quick fix. There is no quick fix. And unfortunately, it takes work. And I say clearly in my book early on in one of the early chapters that the path to healing is not for the faint of heart. Okay, it's not for the faint of heart because it does take work. It does take effort. It does take courage. It takes courage because sometimes you have to go deep within your mind and your heart and just kind of root out all those obstacles that we have to healing. And those obstacles can be mental, they can be emotional, they can be energetic, and they can even be spiritual, right? So we are multifaceted beings. We're not just a physical body. We're not just our thoughts. We're not our emotions. And unfortunately, our healthcare system does not acknowledge this totality of who we are. And the third obstacle to optimizing your health is that most people do not know who they are. So the last statement I made kind of leads into this. What do I mean when I say know who you are? Okay. If I were to ask, um, let me ask this question, and you can type it in the chat or you can unmute yourself and answer the question. If I were to ask any of you, just a simple question, who are you? How would you answer that? Go ahead and answer it, or just type it in the text chat if you don't want to speak. Who are you? Simple question, but it's not so easy to answer. Okay, so Mark said I would probably list my life roles. Okay, good answer. Anyone else want to take a stab at that? Okay, that's okay. So that's a great answer because, actually someone said, I don't know. Excellent. Okay, that's a great starting point. Margaret said, I don't know. Okay. The thing that we need to understand is most people will define themselves by some sort of attribute that they have or a role they play, okay? And I'm going to tie this into health and healing and why it's important. Just give me a few minutes because I have to kind of lay the framework here. So most people, if I ask them, who are you? They will say, well, whatever, I'm Noman. They'll say, well, I'm my name. I say, well, you're not Noman because that's just a title that someone has given you when you were born. So who are you? They'll say, well, I'm this physical being that you see before me. Well, I said, well, no, you're not exactly that physical being. This is just a form that you are incarnated into here in this physical life on this planet. So you're not your physical body because the thing is that your physical body is only going to last a short time. So you're not who you are. You're not the physical body. So who are you? And I'm just going by what other people answers have given me, right? About when I asked them this question. Well, I'm my thoughts, I'm my mind. Well, you're not your mind, right? Because the thing is that your thoughts are fleeting. Your thoughts arise, we have 50 to 60,000 thoughts in a typical day. So thought comes and goes, and most of our thoughts are negative. So if you were to identify yourself with those thoughts, for a lot of people, that would be a depressing concept, because the thing is, most of our thoughts are fleeting, number one, and a lot of our thoughts are negative. So no, you're not your thoughts. Your thoughts arise from your mind, and you're not your mind either. The mind is a tool that we've been given in order to navigate the world we live in. So you're not your mind. So what else are, so who are you? Well, I'm my feelings, I'm my emotions. But emotions, you're not your emotions, because the things are emotions are also subject to change. They're never constant, right? Because sometimes, we would love to always live in joy and peace and happiness and love, but sometimes we feel grief, anger, we feel fear. So we don't want to identify with those emotions, but our emotions are an experience we have here in this physical plane. It's how we communicate with our higher self. When I say higher self, I'm alluding to our true nature. So if I keep asking the question, so Mark, you mentioned, I'm my roles. So the thing is that we play a lot of roles in our lives, right? We can be parents, we can be siblings, we're someone's children. There are also the roles we play in our careers. You may be, I have a role of a physician. You may be an attorney, you may be a police officer, you may be a firefighter, you may be a nurse, you may work an accountant, you may work in an office, you may be a manager, you may be a supervisor, you may be any number of things, right? But these are just roles that you're given here in order to carry out your position, your work, the work that you do. So you're not your roles. So then I keep asking the question, so who are you? Well, who we are is beyond physical body. It's beyond thought. It's beyond emotion. It's beyond our roles. It's beyond who we perceive ourselves to be, because we are that deeper energy, that consciousness, that being that permeates this physical body, right? Because and this is not a religious concept. It's more a concept that I've come to understand, is that this physical incarnation here on this planet is is just one aspect of who we are. Because, and you don't have to necessarily agree with this or accept this, but I believe that, we existed long before we were born in this life, in this world, and we exist long after we're gone, because we're that energy, right? We're that consciousness. If you're a religious person, you might refer to it as soul or spirit. I like to use the word consciousness or being because it transcends any belief system. So we are that deeper being, we are that deeper energy. And when we are talking about health and healing, we have to realize that where we have to work from that deepest part of who we are. When we're talking about health and healing, we can't just address our health at that physical level. What I have found in a lot of my patients is that a lot of their chronic illnesses are symptoms of a deeper problem. Okay, so stress is something that is very common in society, in our modern world, with how fast-paced things are, with all the rapid changes that are happening in technology and the fast pace that society moves at. Plus all the challenges that we're dealing with in this day and age. We just got over a pandemic. There's a war in Ukraine. We're dealing with climate change. We're dealing with inflation. We're dealing with, economic uncertainty. There is a lot of stress that people are under. And the thing is that a lot of the diseases that people manifest have to do with not being able to deal with that stress. And often that stress arises from something in our past, something that we've experienced that we haven't processed. It could be a major traumatic experience. It could be something minor. It could be something that you don't even remember. But often, we have these experiences when we're growing up. It could be something as simple as, say you were from a big family, you had many siblings, say 3 or 4 or 5 siblings, and you were neglected. Maybe you were the youngest, or maybe you had a lot of burden you had to carry for your siblings. You were the oldest. So it could be simple things. I'm not talking about necessarily physical abuse or, sexual abuse or anything like that. It could be emotional neglect. It could be any number of things. So we often carry these traumas from our early childhood, and when we're children, we don't know how to deal with them, right? So we try to block them off. We try to cut off those emotions that are painful to feel, and that causes emotional blocks and subconscious blocks. And what happens is that when we face stressful situations later in life, it is those blocks that that come up and prevent us with effectively dealing with stress, because stress is a fact of life. We are not going to escape it while we live on this planet. It's how we navigate that stress that matters. And the thing is that the most effective way to navigate all the challenges in our life is to realize who we are at our deepest level. And I have a lot of patients who, I'm just trying to think of an example. So I have a client who has mixed connective tissue disease. It's an autoimmune disease that attacks the tissues in the joints. And I started to dive deep into his issues and where this arose. And it turns out that when he was a teenager, he was really fascinated with, he's from Scotland. So he calls it football. We call it soccer, but he was fascinated with soccer. Like, he almost became a professional football player, but he didn't really make it. And then he was a talented musician. He played the piano, he was a DJ. And then, when he was in his late teens, maybe early 20s, his parents told him, you need to give all this up and you need to actually go to college and get into a career where you can make a living. This is not going to get you anywhere. Even though that was his passion, right? His passion was football. His passion was music, it was piano. So he went into college, he chose a career in IT, I believe, and he became an IT specialist. and he hated it. He hated it with a passion. And that wasn't the only thing he experienced. He experienced a lot of physical abuse when he was a child, which he hadn't processed, he hadn't dealt with. And what happened is that he started developing these symptoms because he was not living his true mission. He wasn't living his life with a deeper meaning. He was in this profession, started developing all these symptoms, a lot of pain, chronic fatigue, had to actually go on disability. And then he also was in a very toxic marriage. And then that was another stress. And the reason he put up with that abuse is because he had put up with abuse that his father had dished out. So he put up with the abuse from his wife, who is now his ex-wife, and he went off on, and they separated and divorced. But my point is that so he this disease in his body, mixed connective tissue disease, I believe, although I can't prove it, right? I can't do a test to prove this. It arose from him not processing all these traumatic experiences he's had and not following his true passion, not following the true meaning of his life. So when I say you need to know who you are, not only do you need to know who you are as that consciousness, that being, but you need to know why you're here, right? Because we all have a bigger reason for being here, right? And very few people discover it. The people who discover it are the luckiest people on the planet. So knowing who you are is not just knowing yourself as that soul, that spirit, that consciousness. It is knowing the bigger reason why you're here. Because a lot of the symptoms that we experience, chronic pain, trouble breathing, and chest, other symptoms that lead to chronic disease arise because most people are ignoring that deeper calling, and that voice will always be there, right? I mean, I'm not saying it's easy to find the reason for being, why you're here, but the thing is, we all have that calling. We all have a deeper meaning for being here. We all have a higher calling, right? I mean, it's not about doing something like saving the world, right? It could be something as simple as raising your children to be the best human beings they can be, and helping them find their path. It could be something as simple as raising children. It could be something as simple as volunteering at a senior's home or volunteering with children. It doesn't have to be something that's life, that's world altering, right? When I talk about that. So the third obstacle to optimizing your health and healing is not knowing who you are at the deepest level. So and everyone has to discover that for themselves. Okay. So I just want to see where we're at here. So we're at about 8:29, 8:30. I've talked for about 25 minutes because I started a little 5 minutes late. So I'm just, what I'm going to do right now is I'm just going to open it up and there's only a few of you here. And I'm just going to open it up and see if any of you have any questions. And you can either put those questions in the chat, or you can unmute yourself and ask those questions. So feel free to do either. And if there are no questions, there may be a few other things I can talk about. But yeah, go ahead. I'm open to answer any questions about what I've talked about, or any other questions you have about health and healing. Because there's a lot more I can talk about, but I just wanted this to be interactive, not just me talking to you for an hour. So,
Dr. Naim, thank you for doing this.
hey,
I'm wondering how this beta program that's how you refer to it in your invitation, how does it extend beyond what you've written in your book?
are you talking? Okay, so I have a program that I am testing right now. You're talking about the reversing autoimmune disease?
Yeah, that's the one you mentioned in
Yeah, okay. That's interesting. So, okay, so I'll talk a bit about that. I'm glad you brought that up. So, there's a lot of people in the holistic health space right now. I don't know if you know most people know who Deepak Chopra is. He's been around for decades. There's also newer people in the holistic health space. There's Dean Ornish, who focuses on heart disease. He's written multiple books, and he teaches people how to reverse heart disease. There's There's also Mark Hyman, who's a functional medicine specialist out of Cleveland, out of the US, Cleveland. He's written a lot on functional medicine. So he focuses on general health, how to optimize your health and well-being. And there is many others, like there's too numerous to mention. There's Lissa Rankin, who's written a book, Mind Over Medicine. And she's also written a book recently called Sacred Medicine. And she talks about overall health and healing. But when I look at the holistic health space, right, and there's so many people in it now, health coaches and functional medicine docs and other people. There's nobody, to my knowledge, now, I mean, maybe I haven't done enough research. There's nobody focusing on autoimmune diseases, okay? So let me talk a bit about that. So there's a lot of people focusing on heart disease and cancer and diabetes, but nobody, and there's actually people in the diabetes space as well. They help you reverse diabetes. One is Mark Fung, who's a nephrologist out of Toronto who does this work through fasting. So, but nobody's talking about autoimmune disease. So what is an, let's define this. What is an autoimmune disease? An autoimmune disease by definition is when your immune system attacks a tissue and organ in your body. So I'll give you some examples. Rheumatoid arthritis is your immune system attacking your joints. Lupus is another autoimmune disease, your immune system attacking not just your joints, but it can attack your heart, your lungs, your kidneys, multiple organs. Hashimoto's thyroiditis is a thyroid condition where you have your immune system produce antibodies that attack the thyroid gland, right? So these are just a few of the multiple autoimmune diseases that are out there. And what got me interested in this is I'm a pulmonologist, a respirologist. In Canada, they're referred to as respirologists. So I get referred a lot of patients who have autoimmune diseases that affect their lungs. And, you know, because I am bound by the College of Physicians and Surgeons of Ontario, where I practice, you know, I have to follow the usual guidelines. So, you know, I put a lot of these patients, you know, I send them to rheumatologists and I manage them in cohort. We put a lot of them on immune suppressive drugs, okay? So, you know, things like prednisone, things like, you may not be familiar with any of these, methotrexate, mycophenolate, cyclophosphamide, a bunch of other drugs. And what I have found is that none of these patients get better, okay? None of them get better. In fact, they all develop side effects. And this really perplexed me, right? Because here I am, I mean, I'm a practicing physician. I've gone through all this training and there's this whole group of patients who I can't really help with autoimmune disease. So seeing what I've seen in my practice, and it's not just my practice, it's the practice of other similar specialists who deal with this. I've written this book, so I started saying, well, how can I apply my book and the concepts in my book to these people? So I started to devise a program that to try to see if I can help these people, because autoimmune disease, I believe, is multifactorial. Okay. I believe that it has to do with nutrition. It has to do with thought, thinking. It has to do with emotions, emotional blocks. It has to do with the subconscious mind. It has to do with lifestyle. It has to do with toxins, because we're exposed to thousands and thousands of toxins on a daily basis. Food we eat, the water we drink, the air we breathe. Our hygiene products, right? Because I've gone on a personal journey of trying to remove any toxic cleaning products or personal care products from my home as best as I can, because we have no idea what's in those products and what we're exposing ourselves to on a regular basis. So it has to do with toxins, it has to do with lack of movement, and it goes down to the deepest level as well, right? Like not living out your true meaning, your higher calling, your mission. So this is really, I don't want to call it an experiment. I'm actually testing this program currently with a number of people, number of clients, to see if I can and I make no guarantees with this, right? Because I can't, even though I am a physician, but this is going outside the realm of my practice as a physician. So I'm doing this more as a holistic health coach. And that's what I call my, like, I don't tell these clients that I'm working with to stop their medications, to stop seeing their doctor, stop seeing their specialist. They should do whatever they're doing, unless whatever they're doing is harming them. And then they have to talk to their doctor about, the toxic effects of the medications. But I'm putting them through this program and I'm really testing it because my research has shown me that there's as far as I know, and I may be wrong, but there's nobody out there doing this with autoimmune disease specifically. They're doing it for all these other health conditions, but not for this. And that's what got me interested in diving into a space that's really not being addressed by in the holistic health space. And I have a huge vision for this program, right? Because I want to create a program where I can launch it and help as many people as I can. I'm doing it one-on-one right now, but eventually I would make it a group program, maybe even a certification for people who are interested in working with people with autoimmune disease, maybe helping rheumatologists expand their scope, open their repertoire as to how they help these patients. And I'm not saying that, these medications like prednisone, for example, are not needed at a certain stage of autoimmune disease. Sometimes these patients get very, very sick. They end up in the hospital and they need those anti-inflammatories to get them beyond the acute phase. What I'm talking about is when you get beyond the acute phase and you're in the chronic phase of that autoimmune disease. Is that all there is? It's just these toxic medications for life that cause all sorts of side effects. And I've seen it, like I speak from experience, right? This is not just me reading about this. I have actually treated these people and I've seen it. So that's what really motivated me to come up with this program, which is, like you said, Mark, it's in the testing phase. And I'll know by the people I'm putting through it now, I'll know by the fall, what the results are, and then where I'm going to take it next, whether I'm going to, launch it as a fee-based program and make it into a group program and take it from there. Because I really have a passion because I truly understand. I mean, I'm always learning, but I have a certain understanding up to this point of what goes into health and healing, and I want to apply it to some of the conditions that I've been dealing with over more than a decade. So yeah, that's where that arose from. Does that answer your question, Mark? Yeah, okay. Any other questions anybody has? It doesn't have to be a question. It could be a comment. It could be something, you want to comment on, or any other thoughts. Has anyone, let me ask you guys a question. And I think I've already asked you this, but I'm going to ask you, has it, you know what, okay, I've already answered this question, and this goes beyond health and healing, but I'm going to ask a follow-up to that question. And feel free to either unmute yourself and answer the question or put it in the text chat. What are, and you may get this somewhere else, but probably not. What are the 3 most important questions anybody can ask themselves? Does anybody know? I've already given you a hint when I talked earlier. So what are the 3 most important questions that anybody can ask themselves? And this doesn't just apply to health and healing. It applies to every aspect of your life, your relationships, your career, your personal fulfillment, and your inner peace. Any idea what they are? No? Okay. So I'm going to tell you, okay? Because, and this isn't just my information. I've gotten this from other mentors and teachers. So the first one I've already talked about in extensive detail. The first most important Okay, so someone actually attempted to answer. Am I aware, present? Am I fooling myself? That's two. Okay, those are great questions. Well, I'm gonna take it even deeper. Uh, that's interesting. Am I fooling myself? Um, because a lot of people are fooling themselves. But anyway, so these are those three questions. The first question is, who am I? That's the first question that everybody, and I believe that this should be taught in elementary school. I am so disheartened by the education system. I have three kids who I put through the education system, and I really wish I had an alternative. I really wish I could have homeschooled them, but I was too busy in my career, and so was my wife, so I couldn't really homeschool them. But I just wish I could do it all over with the knowledge I have now, have kids at this point and just raise them a different way. But there's always hope, right? You never lose hope. So this should be taught in elementary school. So the first question is, who am I? You need to ask that question, right? Because most people have no idea who they are. And I'm not talking about what I've already mentioned this. I'm not talking about your thoughts, your emotions, your physical body, your roles, your name, who people tell you are, because we are deeper than those things. We are a lot deeper. We have that consciousness, that being. So when you know who you are in your true core essence, and nobody can answer that question for you, only you can answer that question for yourself. See, we all have the same purpose. Our purpose here on this planet, we're all here for the same reason. What is that reason? Is to discover who we truly are. However, how that expresses is different for each person. We all have the same purpose, but that purpose could be expressed differently for each person. And that the way you express that purpose is your higher calling, your higher mission, your reason for being here, right? So, who am I? Now, the second question I've already alluded to, why am I here? Any of you asked yourselves that question at any point in your life? Why am I here? You can just type a Y or no in the text chat. Has anyone asked themselves? Yes. Okay, I'm glad you have. Um, I'm just curious, Mark. I don't know if you want to share. If you don't want to share, just type a no. But when you asked yourself that question, at what point did you ask yourself? And oh, Margaret also asked that question. So what did you come up with, if you're willing to share? And at what stage in your life did you ask yourself that? And if you don't want to share, just say no. And if you do want to share, just unmute yourself. No? Okay, that's fine. Hold on. I think you said something here. I'd love to share, but I don't want to monopolize the session. Okay, that's fine. That's okay. No problem. So, okay, so you know what? Someone's requesting you to speak. Go ahead, Mark. You won't be monopolizing. We have time. Just a few minutes if you're willing to. And if you don't feel comfortable, just say so.
No, I do feel comfortable.
Yeah, I'm just
I
curious.
would just say there isn't one time. I am a certain kind of person, made in a
Yeah.
certain kind of way. In my graduate work, I've done lots of personality testing, and
Yeah.
so even now, with the knowledge that I have, like you were just saying, Doctor, with the knowledge you have now, you might not have educated your children in a certain way, but
All right.
even apart from the education system, I remember as a young person wondering those things. Probably, probably wasn't normal, but I did. And again in my teens, and again in my 20s, and again in my 30s, I've actually been able to track these, breakthroughs
Great.
once a decade.
Nice.
And one came just earlier this year, which I was going to frame as a question a little later.
Okay.
Uh, so yeah, I have asked myself those questions, and there's always been I would say it's the same answer, but with different applications and different sort of awareness because of my life stage.
Yeah. What has been, if you don't mind sharing, what has been the answer that's come to you? You said it's been the similar answer, but applied differently.
Um, well, I mean, it sounds so simple, but it's so difficult, to love others. You know,
That's
I,
great.
I'll tell you, so my breakthrough in my 20s came pretty early. I was married at age 20,
Yeah.
and I wondered why the first 3 years of my marriage was so rough, so
Okay.
hard. I thought it was her,
Okay.
and I realized after 3 years it was me.
Ah,
And there's a spiritual dimension here too, which I'll allude to later. But once I realized that, it helped me focus my purpose not on myself but on others.
yes.
But I was amazed at how much that fed back positively on me.
Right.
Um, so yeah, and it's always been a variation on a theme. Even my recent changes and breakthroughs
Yeah.
to do with getting healthier holistically
Right.
is about being here and serving my family and my
Yeah.
work
Excellent.
and and others well.
That's amazing. And that, does that feed into your career? Like what is your,
Yeah, I have a multifaceted career. I'm a librarian and an instructor.
oh, excellent.
I'm
Right.
also uh, I'm also a priest, an Anglican
Oh,
priest,
great.
and I'm on the road to becoming a Naval Reserve chaplain.
Oh, nice. Excellent.
So yeah, so there's a
Yeah.
lot.
Yeah. Thanks for sharing, Mark. I just want to just make a point here. Thanks a lot. That was great. The point I want to make is that, when I talk about why am I here, right? When I ask that question, or when you ask yourself that question, this is not necessarily about career, right? Because the thing is that the problem, this is a question that every child should be taught to ask themselves. But unfortunately, the education system, what it does is that it conditions children. It kind of feeds them the society's agenda, or a popular culture's agenda, or whoever's agenda, and tries to pigeonhole our children into certain categories and to pick a certain path and to pick a certain career, right? And this is what our whole education system is about. It's about pigeonholing people into a specific category and then following that path and then doing post-secondary education in whatever. I mean, you pick whatever, engineering, or you want to go into social sciences, or you have, but this is not the whole purpose of education. The whole purpose of education, if you look at the earliest educational institutions that arose in the Middle East, right? Thousands and thousands of years ago, they were about acquiring knowledge of various aspects, various aspects of the world that we live in. People would study philosophy, they'd study mathematics, they would study science, they would study music, they would study psychology. They would study all these different things. They wouldn't just be pigeonholed. And it's all about not just living and learning about the world and the universe that we live in, but learning about self. It's about self-knowledge, right? Because anything that you learn helps you uncover the deeper aspect of who you are. So, why am I here? I mean, I love your answer, Mark, because the thing is that I think at a deepest level, right? I think everybody is here. See, we don't live in isolation. We're all here for other people in some degree or form. It may be in a different facet or in a different way. We're all here for others. But why am I here? What is your specific gift that you have to bring to the world? right? Because we all have our gifts that are unique to each of us. And we're not just here for ourselves, we are here for other people. But by being of service to other people, we uplift ourselves, we elevate ourselves, we illuminate ourselves, and we benefit ourselves as well as other people. So this is the second question everyone should ask: why am I here? And actually, I'm gonna put in a fourth question. It just came to me. So the third question is, where am I going? Oh, actually, by the way, before I move on, does anyone else want to answer that question about what came to you? I think Gabriella, you want to answer that question? So I'll let you answer as well. When you asked the question, why am I here? What came to you?
So I came to a very painful realization, at least for a couple of years. The reason I'm here is to put a stop to let's call it the evil that was coming in my family from all sides, my family of origin, the family that I enter into.
Right.
Innocent, unprepared, unequipped, and then huge effects. And as much as I wanted always a career and to grow and to do, none of that happened because of these blockages.
Yeah.
So actually somebody said, and just resonated with me, some people are born to accomplish great things and
Right.
to help humanity. Other people are born to put a stop to bad things.
That's
And
interesting.
I feel that's the case with me for now.
Yeah. That's
I
it.
can't look for the future until I'm recovered fully.
Right.
So this is the stage that I'm on. And part of the only major component of this was the job, the work, because that was my biggest sacrifice that I made in life, give up my career or family. And nothing good came. Everything turned against me, but I gave up that. So for me to start now from scratch is what I'm doing. So I'm grateful for this job that I started a few months ago, and just want to progress step by step without thinking too much of age and anything else. So this gives me back my dignity that was trampled on, and financial survival, because that's my truth, financial survival.
Yeah.
I want to do things, but financial survival is nothing and nobody to back me. So yeah, so I realized after this realization, I got such a peace and a calm. And I know for now, I don't know, a year or so, I don't even want to think about, I'm just doing what is like, I needed this medication so badly, now I have. So now I just have to focus for it until I will feel that it's time to think about something else.
Yeah. Thanks for sharing. That took a lot of courage to share that. What really struck me from your share is that you're living in the present moment, right? Because you're really focusing on what is needed right now in your life, like what you need to focus on. And that's absolutely incredible. And I agree with Mark. Thanks for your vulnerability. I mean, it seems like you know why you are here. And the thing is that very few people know why they're here. They just follow the dictates of society. And often it takes pain and suffering in order to come to that question, right? Unfortunately, we have to go through that. I wish we didn't, but this is as such as our world is. I'm gonna ask Margaret, I don't know if you want to share. I don't want to leave you out. I want to give you the option. If you don't want to, you can just type in a no. If you feel wanted to share something, feel free. And if not, then it's okay. I can move on with what I was talking about.
Can I just add one
Oh
more?
yeah, by all means, go ahead. Yeah.
So part of the struggle, you know my details, doctor, was that I tried so hard for 1.5 years to get back to work. And it was getting harder and harder, and I was going lower and lower.
Yeah.
But I tried, and I took lots of training and lots of networking and all that. And I had a lot of interviews. None was successful.
Mhm.
However, I had to move to rent another place. The new place is so much better than before. I couldn't ask for more. And guess what? The job came through the people in this house,
Nice.
out of the blue. So I know I prayed a lot. And at one point, I really involved God a lot. I mean, it was nothing more I could do. Everything I did went wrong or nowhere.
Yeah.
And then this job came out of the blue.
Mhm.
But I did my work and effort, but was not successful. And here I did nothing, and this job was offered
Mhm.
to me. So I'm coming to recognize more the spiritual side and the miracles that happen, and everything that you mentioned in the beginning, the energy and
Yeah.
that components as well.
Amazing. You know, it reminds me of a saying which is, you know, when one door closes, another door is about to open, right? And you've all heard that saying, right? Seems like all the doors are shut, you know, they shut in our face. That's just because you haven't come to the right door. The door is about to open somewhere else. So I think that it's a powerful lesson. And thank you again for sharing your story. That's an amazing story. There's a lot to be learned from what you just shared. Okay, I'm gonna, let me see. Okay, actually, Margaret types something. I'm just gonna read it. Just gonna read what you said. My challenge, retired for some years with health problems, I've come to avoid. I have no idea what I'm doing here. Everything I thought I was, thought life is, no longer applies. And let me tell you something, Margaret. It may not seem like it, but that's a beautiful place to be. Okay, now what do I mean by that? I have no idea what I'm doing here. Everything I thought I was, thought life is, no longer applies. Come to a void. The void is a beautiful place. It's because the thing is that often the things that we accept, the things that we believe, the things that we thought were true, often prove not to be. They often fail us. And when, you know, everything falls away around us and before us, then what's left is a void. And it's that void that is that void that is that where we came from. We actually came from that void. If you think of the birth of the universe arose out of what we call a Big Bang. What was the Big Bang? It was just this cataclysmic explosion that came from a void, right? And that nothingness is not nothing. There's something there, right? If you're a religious person, you might call it God. Other people might call it a higher power, consciousness, whatever. But that void is a beautiful place because that void is where we arose from, and it's the starting point. And if you end up back there, all it means is that you're in the process of rediscovering who you are, right? You're in that process, and the answers will come. Okay, the answers will come. You just have to be open, have to be, you know, just completely open and keep your heart open, and the answers will come. With time, they will come. Okay. Thanks for sharing. Thanks for sharing, Margaret. So the two questions I had just gone over. So who am I? Why am I here? So the third question arises out of probably the first two questions is, where am I going? Very few people ask themselves where they're going because they just let the dictates of society and all the external influences that are kind of buffeting them lead them where those influences want to lead you. But we're not here to be led. We are here to lead, right? We are here to lead. I'm not talking about leading other people. I'm talking about leading ourselves. We need to ask ourselves you need to ask yourself, where am I going, right? And the key to that answer, to answering that question, is going to be, why am I here? So once you're able to answer that question, why am I here? Then you can ask yourself this question, well, where am I going? So if you have that knowledge, you've answered that question, why am I here? And it seems like a lot of you have, then where am I going? And then you can chart your path, chart your life's journey, right? And you may not know where you're going, right? You don't have to know the destination. All you have to know as the answer to that question, where am I going, is, what is my very next step? It's that simple. You don't have to know the path 100 kilometers ahead, even 10 kilometers ahead. You just need to know, what's my very next step? And that's what I mean by, where am I going? So you have to have the knowledge of who you are, why you're here, and then you can answer this question, where am I going? Okay. Let me ask, actually, everyone, have any of you asked yourself this question about where am I going? I know I've asked myself all these questions, and that's why I'm here on this webinar, but I mean, that's why I've done what I've done and I'm doing what I'm doing. But has anyone ever asked themselves, where am I going?
I have, and I'll just jump in to say
Sure.
that it is
Yeah, go ahead.
actually, I'm using that as a segue in a hopefully a humorous way, because I need to go and have dinner with my family now.
Of course,
It's
of
6
course.
p.m. over here, so
Oh,
I've really benefited from this. Thank you so much. Look forward to your future work.
thanks. I appreciate it. And actually, before you go, I'm just going to say the last question. I'm just going to give you the benefit of hearing that. So where am I going? And the last question that everybody needs to ask themselves is, once you ask yourself, why am I here? Where am I going? The next important question, the fourth question, is, who's going with me? Who's going with me? That is so important, because the thing is that we don't live in isolation. We are in relationship. We're not isolated. We're communal being. We're social creatures. We live in relationship. It doesn't have to be a romantic relationship. It could be family. It could be friends. It could be people who you work with. It could be acquaintances. It could be anything. It could be clients, whatever. Who's going with me? So these questions you need to ask: who am I? Why am I here? Where am I going? And who's going with me? These are the most important questions you can ask. Feel free to share this with anybody, anybody who you want to. And that's fine, Mark. I know you got to leave, and thanks for being here. And I'm just gonna see if anyone else has any questions or comments, anything they want to ask. And if not, then I'm gonna bring this to a close. Any other questions or comments from anyone?
Yes, I just like to say, so the third question, where am I going? How do I know?
So this is yeah. So this is good. This is the thing. How do you know? So you know why you're here, right? Because you already answered that question. Correct? Right now you know why you're here.
Yeah. For the time being, yes. Until
For the
that
time being.
yes.
So that'll give you a clue as to where you're going, because if you know why you're here, the next question is, well, if I know why I'm here, what's the very next step I need to need to take in order to fulfill the reason I'm here. So the question about where am I going doesn't have to be overwhelming. Like, you don't need to know the end point, the destination. When I say where am I going, all you need to know is what is my, if you know why you're here, what is the very next step I need to take in order to fulfill the reason I'm here. It's that simple.
Yes, and I noticed that closer I get on the spiritual side, more progress I make on the spiritual side, more sensitive I become to notice things and to trust more in God.
Yes.
And to notice things that could lead me in any direction. So I became very flexible. I make my plan to the best for the week, for the month, but many times an invitation comes or something comes unexpectedly, and I really take it serious. I don't just dismiss it.
So this is an important point, because the thing is, what you think is the next step, may not be the next step. You may have an insight, you may have an intuition, you may have a sign from the universe that points you in a different direction, right?
And it happens a lot lately.
Yeah. So the thing is that just because if you're able to answer the question, what is my next step? It doesn't mean that that's not going to change, right?
Exactly.
You might go in a certain direction, but the thing, when I say, where am I going? You have to have a general idea.
Right.
And it doesn't have to be specific, just a general idea. Like, okay, well, this is kind of why I'm here. This is the general direction in which I want to go, right? It's just like somebody who's lost in the woods. You know, if you're lost in the woods, right? And you may not know exactly where you're going, but you need to have a general idea. So how do you find the general idea when you're lost in the woods? Okay, well, you say it's in the middle of the day. Well, you look at the sun. Where is the sun? What time of day is it? You know, is the sun, the sun arises in the east and sets in the west. It gives you an idea as to, where's east, where's west, where's north, where's south. So if you know those directions, then you have a general idea of the direction in which you need to go, right? So if you're lost, you need to have at least a general idea. You may not get to your destination in a straight path. It may be a meandering path. You may have
That's
to.
very, very helpful. A general idea, but not.
But not fixed.
Yes, not specifics and flexible.
Yes. So a general idea, like, I'm just using the lost in the woods as a metaphor, but like, if you know why you're here, then you just have to have a general idea of the next step you need to take. It may be shown to you to be completely different than what you thought, right? It may be completely different, but have a general idea, and the universe will respond to that, and it'll send you signs. It'll send you, it'll point you in the right direction, right? You always have to trust that if you are true to yourself, if you know who you are and why you're here, that means you're being true to yourself. You will be led to the very right next steps that will get you to where you need to go. Okay? So it comes with trust. There has to be a certain degree of trust.
Trust in God and trust in myself to my best ability, but trust really in God, and that increasing the prayer time, trust, that's the word. All kind of trust.
Yeah, for some people it could be prayer, for others it could be meditation, for others it could be spending time in nature, for others it could be journaling. It's different things for different people. If it's prayer for you, that's wonderful.
And also I have to say, what helped me a lot was I did a lot of purging of my relationship and friends, and I got new sets of acquaintances, not necessarily friends, on different areas in my life, professional interest, like holistic spirituality. So I have groups of people now, and it's amazing, but it was hard work to change
Yeah.
The people in my life, a lot of them, some are, of course they are there, but so it was a big effort, but it's just so amazing to meet new people, to look for them, and then to on different areas of life that everybody goes the next step in that area.
Right. No, that's great. That's wonderful. And that's part of your journey as to where am I going, right?
Yeah.
That's part of your journey. Is part of it where you're going is so you actually are answering the fourth question, who's going with me, right? So
Yes.
you've met these other people who have now come into your life. So you're answered that question as to, well, who's coming with me? And you may not always know the answer to that question, right? Like when you ask that question, well, if you know where you're going, well, who's coming with me? You have to ask yourself, well, are the people who are in my life right now, are they coming with me? Or do I need to leave them behind? And often it's a quite difficult question to answer, because often we find that we're on a path and the people who have been with us up to this point do not share the same vision. They don't share the same
Exactly anymore.
They don't share the same, they're not on the same growth path. They're
Right.
in different direction.
So,
And this is why I think a lot of relationships come to an end, right?
yes, and I had a lot of guilt about that, very difficult. And the way I found the solution was I'm very grateful for the time they were in my life, because I needed them at that time.
Yeah.
So, but now the relationship changed. I'm very grateful for what it was, but now it's not beneficial anymore. So I keep it to a minimum. This is how I found my peace, because I don't have time for chit-chatting, useless things. But I needed that 3 years ago. I needed that.
Yeah.
But right now, but they didn't change. So what do I do? Exactly what you said.
Exactly. So the thing is, that's why that fourth question is very important. Who's coming with me, right? So,
Yeah.
I mean, and the thing is that sometimes you don't have to answer that question. The question will answer itself.
Right.
Because the people, they see you're on a certain path. Either they'll want to accompany you or they won't, right? So it will work itself out. And then along the way, you're going to encounter other people who may share your same values. They may share your same vision. They may share your same ambitions. They may share the same goals or something similar, right? So all hope is not lost, right? If you lose people along your path, right? Because just like you said, you have to be grateful for the time they were with you and what you learned from them and what you contributed to them, what they contributed to you. But the thing is that, we are not here to choose other people's path. We are here to choose our own path in life. Now, if people are able to accompany us on that path, wonderful, right? That's wonderful, but not everybody. I mean, often paths intersect, right? And then you follow the same path, and then you go your separate ways. And there's nothing wrong with that. Sometimes it's painful when you've been on a path with someone for a long time, and then you kind of go in different directions. You diverge, you converge, and then you diverge. It happens a lot, right? For various reasons. So that's why it's important to ask that question, well, who's coming with me? Very important. I'm glad Margaret mentioned that she feels refreshed after listening to us. I'm glad you can relate, Margaret. Thanks for your share. We're at about an hour and 15 minutes roughly, and I'm just going to give the opportunity for either of you to share anything you want to share before I bring everything to a close. And I am going to do another webinar like this in July. I just have to decide on the date, and I'm going to put it out in the email list because I want to keep doing this. And I may turn this into a monthly thing. I'll see. I'm not sure where I'm going to go with it, but we'll see. Any other questions or comments from anybody? No.
What is your next book?
Oh, my next book is actually, I've actually sent it to the publisher and I'm just waiting to hear from them. Yeah, it's my next book is called Awaken into the Flow. So it's about awakening and being in the flow. And I'm just waiting to hear from them. It's done. And I have to wait to hear from them because nowadays publishers want almost a guarantee that your book is going to do well before they're gonna, even the one I have, they're asking for a lot of things from me. So you'll all be the first to know we're on my email list.
Yes, please let me know.
For sure. Thanks for asking. Any other questions or anything? Thanks a lot, Margaret. They've been very helpful. Good to be at a sharing place with others. Thanks again. Thanks for being here. And I'm going to actually bring the recording to an end. And at this point, let me just stop.